Hi, everyone. Welcome back. This is our Talk with Terry Tuesday. This is my standing edition today. So, we've had a great summer. It's been hot, it's been warm, it's been cool, but overall, it has been good. And now we are coming to the fall. So, welcome to almost fall. Yay! We are glad to see you all back. We are excited about some of the events that we have coming up, and we'll go over all that. Today, we are going to focus more on our body sculpting because the bikinis are now going away. Not that I wore one this summer, but they are going away. And this is the time to actually really get your body where you want it to be for the holidays that are coming up and for next spring so that you're ready to go when the warm weather hits. So, I'm Dr. Scott Terry. Welcome back with our Talk with Terry Tuesdays that we do every second Tuesday of the month. We're glad to see you. We miss you guys. So let's do a little bit of housekeeping. I'm going to cheat. I'm going to use my sheet. So um, we have, well, I'll do this at the end. Let's just get into body sculpting. What is body sculpting? Body sculpting is not weight loss. It is never meant to be weight loss. It is strictly treating an area on your body that you want to be toned, for it to look better, reduce an area or size, and that's what it is going to do. It is going to treat an area. It is not going to be a weight loss procedure. Now, some of these procedures, you will lose some weight, and we'll get into all of that, but that is not its goal. The goal is to truly sculpt the body and the area that you are concerned with. So let's start with the first. This is our cool sculpting. I think you can still see me. So with the cool sculpting, we have multiple applications that we can use. So I'll show you some of our hand movements. Cool sculpting is meant, once again, strictly body sculpting. So how does it work? It actually destroys fat cells. So when we put these applications on, the area that we are treating is going to freeze those fat cells to the point where the fat cells die. They don't just get stung and hang around, they actually die. And over a course of 8 to 12 weeks, they actually get processed through the liver and excreted out of your body. People tend to have more bowel movements around that time because those fat cells are actually being removed from your actual body. Now, once again, there are different sizes that we use. For people who have a larger volume, you're trying to reduce or do a reduction in a lot of the fat, we actually can put this on. This is, I've lost some weight, so this is too big for me. But you can put these on in different areas. We can do, so I tell people if you can pinch the area of fat, we can probably treat it. So you can treat arms, you can treat the chin, you can treat the abdomen, you can treat the back area, you can treat the axillary breast fat, you can treat the inner and outer thighs. So there are multiple areas for cool sculpting that you can treat. It is not invasive. So people have come in, during their lunchtime, get a treatment and go on their way. It is not something that you have to take off work for. You may have some, a little bit of numbing, tingling that generally goes away. So this is a non-invasive procedure that is going to remove about 20 to 25% of the fat cells each time you do the treatment. So once again, is everybody a good candidate for cool sculpting? Probably not. If you have a large volume that you are trying to reduce, cool sculpting will reduce it by 20 to 25%, but it may not be the amount that you are looking for. So we have other modalities and treatments that we can do for that particular client who has more volume that they're trying to reduce. But cool sculpting is a great choice for most people. It is going to reduce an area. that you are trying to treat. Now, so that's Cool Sculpting. Once you have treated the fat, well, actually, let me go to another treatment that we do for fat. So I actually and I'll show you the hand piece. I actually do liposuction. It is not, this is invasive. This is something where I am actually going to, so this is one of the hand pieces that I use. You can see it. I don't know how well you can see it, but I am actually making an incision. They're tiny incisions, probably no bigger than the tip of this pin. So what it will do, I actually insert this cannula and suction out fat. So this is going to give me the ability to remove up to about 3 liters of fat. Is probably no more of that of what I will do in the office for safety reasons. You do not need general anesthesia for this. How we do this procedure, we do it in the office. You can choose the music of your choice. Most of the time, people don't remember doing this. We numb the area completely. There's medication that you're going to take, and we actually give you laughing gas. Once again, the majority of the people who have had the procedure don't really remember it because of some of the medications that we give you, but it's very safe. It's not general anesthesia, and it works. But I can remove a lot more fat with this than I can with Cool Sculpting. And I'm able to sculpt you a lot more. The device that we have is called Beautyfill. We chose this device because it also is really meant for people who want transfers, because we don't have to process the fat or anything like that. The device is already set up for people who want to move the fat to other places. People are like, well, what am I going to do with that fat? I don't want it. I wanted to get it out of my body. So let me tell you the benefits of fat. No, you do not have to use the fat that we removed, but if you choose to, we have had people use it as a filler in place of a filler. So your fat has growth and regenerating factors. So you can put the filler in your face. You can put it in the hand. We have had people do almost like a labioplasty, which is for my women. If you don't like how the vagina looks, you can actually use that fat to actually plump the labia. You can use it, of course, for butt transfer. You can use it for filling out the breast a little bit more for those patients or clients who want a little bit more fullness in the breast. So you can do a variety of things. The hip dips. You can do a variety of things with the fat. You're not required to keep the fat. So if you just want to come and have the fat removed, we can do that. Recovery time is probably a couple days. You're going to be sore for several weeks, but being where you can't do anything, maybe the first 1 or 2 days, but we have you up moving around pretty quickly. We usually always recommend lymphatic massages. It makes you recover a lot quicker. And one thing that we do require is the garment. So it's called the faja. So it's a compression garment. So that one I actually do require because it actually enhances your result. It makes you recover quicker and you feel better with the garment on. So that is liposuction. And once again, you can, just like Cool Sculpting, you can lipo any area that has fat. So we have done the chin, we have done the arms, we've done the abdomen, we've done the inner thigh. So we have done a lot of different areas for liposuction. But I tell everybody, we want you to come in for a consultation because each procedure or service may not be ideal for you. So we want to make sure that whatever service you're interested in, that it's going to be something that's going to give you the results you're looking for. Now, after you've gotten rid of the fat, here we are with Emsculpt. So what is Emsculpt? It actually builds muscle mass. So it gives you more definition. So once you've actually gotten rid of a lot of the fat cells, this may make those muscles that we have not been able to see for a little while Now you can see them a lot clearer. They're a lot more defined, but it's more than just the look of your muscles being more pronounced. It actually helps with building your core. So instead of, and I'm not, maybe I shouldn't say instead of, because I still want you to work out. Um, Doing one session of the M Sculpt is equivalent to doing 20,000 sit-ups. So each session that you do is going to stimulate those muscles to do the same equivalent as what you're doing 20,000 sit-ups. Now, I don't know about everybody else. It's going to take me a while to do 20,000 sit-ups. So still do your sit-ups, but this is going to enhance that significantly. For people who have back pain, not everybody that has back pain, a lot of it can be contributed to your core muscles being weak. This is going to strengthen those core muscles. For my golfers, a lot of golfers have done this procedure because it actually, once again, strengthens those core muscles. And so to make sure your swing a little bit better. For my women and men who have what's called a diastasis, it's where your muscles in the abdomen kind of split apart and you get this bulge coming out. It actually helps to tighten those muscles so that bulge doesn't come out the same way. So it's not just the look and the appearance of what the muscles look like. It actually helps your core muscles become stronger. This also works. So this is our handpiece that we use for the M sculpt. And we put this on the abdomen. Sometimes we have to use two, depending on the size of the patient or client. And this is actually going to stimulate your muscles. Um, it's a workout. I've had it done. You feel the muscles tightening. And we go up at your pace, but you are going to definitely notice a difference with those muscles being stronger, um, with the look of them as well as how you feel. Now, we have another device that we use. It's actually in use right now. It's called the BTL Exilis. It's a skin tightening device. We can also reduce some of the fat as well. Once again, depending on the amount of volume you're looking at, we can tighten the skin and reduce some fat all in the same setting. So we have lots of different options that we have for body sculpting. Like I said, we've got the full sculpting. We have the BTL Express for skin tightening, does get rid of some fat. We have the M Sculpt that deals more with building muscle. And we actually do liposuction. Once again, I've had people come in and think it's that a device that you're saying that it is the smart lipo. No, this is actually liposuction. But the recovery is a lot quicker. Everybody's not a good candidate for liposuction. If you have a lot of excess skin, liposuction is going to reduce a lot of the fat. Our liposuction device also has a laser that's attached to it, and the laser does do some tightening. But if you feel like you have an excess amount of skin, then you're probably looking more at a tummy tuck. And once again, it's hard to tell you without physically seeing you, and that's why we do the consultations for these. But none of this is to replace changing your lifestyle, eating differently, exercising, drinking your water, taking your vitamins and minerals. All of those things are going to be a part of changing your lifestyle, and you actually feel a lot better. So that's my spill on body sculpting today. We'll see if we have any questions.
Yes. For the options that you just gave, what's the downtime?
No downtime with pool sculpting, no downtime with M sculpt, no downtime with the BTL skin tightening. With liposuction, probably a couple of days, maybe 1 or 2 days. We have you up moving around the next day after liposuction. You cannot drive yourself to the procedure. Someone has to pick you up. Once again, remember, I said most people don't remember having the procedure because of the laughing gas, some of the medications, but you are perfectly comfortable. And once again, if you have a preference in music, we play that too. It's a very relaxing environment. So none of these have downtime except for liposuction, and it's a couple of days.
Are the treatments painful?
Not painful, not pain. Well, this isn't painful, but you feel those muscles tightening. The BTL skin tightening, most people fall asleep during that procedure. Liposuction, you're going to have some discomfort because I am physically going in and suctioning out fat. You don't have a long recovery period though. Like I said, it's usually a couple of days. We numb this entire area when we're actually doing the liposuction, and when that starts to wear off, you might feel some discomfort, but I do tell people those lymphatic massages helps you recover a lot quicker. Now, when I say it's a massage, it is not a foo-foo massage. So that first massage, we're trying to get any excess fluids out, any of those dead cells that were destroyed by the laser for the liposuction. We're trying to move all that to your lymphatics so that gets excreted through your body. So none of these you need anyone to bring you, to pick you up, except for the liposuction. Good question.
Will the fat come back after these procedures?
It does not come back. However, if you gain 30 pounds, it is going to go somewhere. So if we take it out of your abdomen, we're not taking out 100% of the fat cells. We're taking out a lot of them. And so those fat cells are gone. No matter what procedure you decide to have, those fat cells are gone. But if you gain 30 pounds, it's going to go somewhere, which is why I always start off with patients and clients. If you feel like you need to lose weight, then let's work on that. And then we sculpt you a little bit more. Some people use it as a kickstart. So they'll see some of the changes already and it kind of continues to motivate them. But what I tell people is no, those fat cells, once they're gone, they're gone. But if you gain weight, it is going to go somewhere. So lifestyle change.
What should I do before and after my treatment?
So it depends on the treatment. For the non-invasive treatment, so the cool sculpting, the M sculpt, the BTL, we've made sure people are really hydrated because the procedures work better when your cells are hydrated. So that would be one thing that I would tell people is that make sure you're hydrated. With any, generally, you should be hydrated anyway. So 64 ounces is what I tell people that they should be doing daily. It's 8 glasses of 8 ounces. So hydrate really well for any of the procedures. Try to limit as much sun exposure for like the first day. But really, there really is no pre or post treatment that you really need to do for most of these non-invasive. The liposuction is a little different, and we give you all of those instructions. We go through everything very detailed before you have the procedure. And it's so that you know, so you're aware, and we're always here if you need to call us.
How long do the sessions take?
Pool sculpting, each area that you're treating is 30 minutes. Except for the chin. The chin is a little more. It's 45. The M sculpt is 30 minutes. The BTL is anywhere from 10 minutes if you're doing the eyes to 30 minutes if you're doing an abdomen. So it just depends on the treatment. The liposuction can vary. Um, you could do arms in probably about an maybe an hour. You'll probably be here for maybe 3 hours, but the procedure itself is different. So it depends on number one, how much volume you have if we're doing liposuction, where you're having it done, if you're getting it transferred. So it varies. But most of these are pretty quick. We try to take pictures for everybody, and it's so that you can see your before and after pictures. Usually, most people will start to see the changes at around 8 weeks for most of the procedures because building collagen, removing fat cells and the skin and everything coming back to its norm usually takes 12 weeks, which is why I said this is the time now to start getting all those things going. 3 months is probably when you see the final and best results for a lot of them, but you'll start to see the changes in about 6 to 8 weeks.
Last one is, what are any side effects?
So, some of the treatments, if you have metal in the body, some people cannot have those procedures. If you're having liposuction, we generally try to get a medical clearance, unless you're below a certain age and you have no medical issues. So it just really depends. But what was the question again? I'm sorry.
What are some side effects?
Oh, yes, side effects. With the cool sculpting, I think there is something that has been out. It's probably less than 1% that this happens to, where if with the cool sculpting, there can be a pocket that gets frozen and kind of stuck. It can be treated, but that's an unusual case. But that's usually the biggest thing with cool sculpting. Like I said, with the other things, certain metals, we can't do your procedure if you have certain metals in your body.
And, oh, there is one more question.
Okay.
Sorry. What makes BeautyFill different than other liposuction treatments?
So the plus with BeautyFill is there's a laser that's attached to it. So most of the time when people are doing liposuction, they're just suctioning out the fat. With the BeautyFill, it actually has a laser. So a lot of times what I will do, and this is to enhance what the skin looks like after I'm done, I laser the area first, which helps to melt a lot of the fat cells. So even if they don't get suctioned out, they die and they will get processed through the liver still the same way. So I laser the area during, before, and after I'm done with the procedure. And then for those who are getting a transfer and using the fat somewhere else, the plus is that those fat cells are going to survive more because it doesn't have to go through a huge process in order to be reinserted into your body. So generally, when most people are getting transfers, the fat that is removed is probably about 50 to 60% that actually survive when you put it back into your body. With the BeautyFill liposuction, it's about 80% survival rate of the fat cells. So we can have a better idea of what it's going to look like when we actually reinsert it into your body. So that's why I like the BeautyFill over some of the other options. It is because it actually has a laser that's attached and it really works well for people who are getting transfers.
I want all the questions. And Valerie Reedus.
Hi, Valerie.
Dr. Terry is the best.
Oh, that was sweet. Thank you, love. Okay, so I have some housekeeping to do. I'm gonna have to cheat because I gotta leave my sheet. So for some of our upcoming events, Thursday, September 26th from 6 to 8, we will be doing our second bioidentical hormone replacement seminar. So what is that? It's for men and women that are actually, their hormones are changing and it is significantly affecting their lives. So we do a lot of bioidentical pellets. And when I say bioidentical, that means it has the same structure as what your molecule has for testosterone and estrogen. So this is when, if you've got questions about it, you can get your questions answered at the seminar. We will have clients who actually get the pellets, do creams. They will be at the seminar to be able to you can actually ask them personally. If you are someone who already gets the pellets, you've got friends that you've told and they're like, what is that? This is their time to find out about what it actually entails. I will tell you, it does change people's lives because when your hormones start to become affected, you're tired, you're irritable, you've got mental fogginess, you don't have a libido, you've got dryness, your skin is changing. It makes you feel differently. And so this gets you back to you feeling like you're normal. So we're doing that September 26th We'll be able to answer all of your questions for those clients who already get them. If you have some people who want to come, we're trying to get people to RSVP so we know which area to set up for. So we'll have enough seating and chairs and information for everyone. So if you could RSVP, give us a call at 708-864-4988. We'll also, after this, have a QR code that you can actually click in and you can register that way. It's just so that we make sure that we're able to address everyone's concern. But for those who get them, if you've got people who are interested in it and they want to learn more about it, you get a I want to say it's a $50 credit for each of the clients that you bring and they purchase. And the new clients actually get $50 off their consultation and they get $50 off their first pellet insertion. So once again, this is for men and women. We see both. But it does change your life. Makes you feel like you're normal. Our 50, 60, 70-year-old is not our parents' 50, 60, 70-year-old. We're living longer. We just want to live better. So that's that event.
Secretary, there's also a QR code. They're looking at it on Facebook or YouTube.
Okay.
There is a QR code that's on the screen, and they can just scan it.
So our Facebook watchers or listeners, there's a QR code that you can see if you're on Facebook, if you're on YouTube, you can scan that and you can RSVP. So it's fun. You'll hear some funny stories. I have had people say you saved my marriage. I mean, it truly does. If you are a client, you already know. It does change your life. I tell people it's like the men's club, the hair club. I am the owner, but I'm also a client. I get them too, and mine was more so it was the fogginess. Couldn't remember certain words, couldn't come up with sentences, walk into rooms, don't know why I walked in them. That gets exhausting. So everybody has a different reason for why they decide or that they're interested in it. But I do tell people you don't have to be miserable. If you're not having any issues, then this isn't something that you need to actually do. But if you are one of those people who this has become an issue in your life, the seminar is going to be September 26th from 6 to 8. Our address is 7151 183rd Street in Tinley Park. But, once again, we'll have a QR code that we'll have up. You can call us at 708-864-4988. So that's our session for today. Thank you guys for joining us. For those men who came to the men's seminar, we're trying to work out some things. So hopefully we'll be able to get that information out for you shortly within the next week or two for the men's seminar with the actual date. Because they had a great time. They learned a lot, which is the goal of all of this, is to make sure we are informed. So my closing statement, be well, be blessed, be healthy, and we'll see you next month.